This is Group 8 and we will be talking about probiotic supplementation and elderly health today. My name is Jiaying and I will be going through the background and aims. The global population is aging rapidly as seen from the 2022 statistics provided by the United Nations here. It is projected that almost 1 in 6 people would be above the age of 65 by 2050. And definitely, there would be problems that are associated with an aging population. On an economic scale, lesser productive workers are present. A larger burden of taking care of the elderly is shouldered upon less and less working population. And all of these contribute to slower economic growth. On a more personal scale, growing old means that our body parts and immunity system weaken. We fall sick more easily and therefore spend more on healthcare. Amongst the various health issues associated with age, neurodegenerative disorders are especially prevalent in the industrialized countries. They include Parkinson's and Alzheimer's disease. To promote healthy aging globally, the paper proposes probiotic supplementation as a possible strategy to target neurodegenerative disorders. Understanding how the probiotic supplement could work involves first understanding the gut microbiota. It is mostly located in the large intestine and has important roles in various body functions. It also undergoes changes during aging that can influence health and disease. Recently, the emerging concept of a gut-brain axis, referring to a bidirectional relationship between the gut and the brain, has linked gut microbiota to age-related neurodegenerative diseases. Diet is an important lifestyle factor that is known to influence both the gut microbiota and the brain. Probiotics are also known to influence these two factors positively. Therefore, the paper proposes the incorporation of probiotics as a diet supplement to positively affect these two factors and reduce the risk of neurodegenerative disorders.
Hi, I'm Zixing and I'll be sharing more about the materials and methods of this study. A randomized, double-blind, placebo-controlled, multicenter clinical trial was conducted. Elders over the age of 65 were recruited with the exclusion of participants with the use of antibiotics, anti-inflammatory and gastrointestinal medications within the past 3 months. In addition, participants with regular intake of probiotics within the past 3 months and those who are incapable of living independently based on activities of daily living scores were also excluded. So, how was this study conducted? The study included a 2-week washout period and a 12-week intervention period, in which during the 2-week washout period, the participants were instructed to refrain from dietary supplements including probiotics and other dietary supplements. Participants were then randomly assigned to either the placebo or the probiotics group. The study capsule for the placebo group contained 500 mg of soybean oil only, while the study capsule for the probiotics contained Bifidobacterium bifidum (BGN4) and Bifidobacterium longum (BORI) in soybean oil. The treatment products were not able to be distinguished by package, color, taste, and smell in order to maintain treatment allocation concealed from participants and study staff. After which, the participants were subjected to a 12-week-long intervention period, in which they consumed their assigned products twice a day for 12 consecutive weeks. During the intervention period, participants visited the clinic periodically for compliance check, blood and fecal samples collection, and neuropsychological tests. They were asked not to change their usual dietary habits and health-related behaviors during the period of intervention, and were asked to keep a record of treatment intake and any unusual events such as the use of medication and experiencing adverse events in a daily manner in order to check for the adherence to the study. The outcomes of this study were primarily split into two: primary outcomes and secondary outcomes. The primary outcomes include results from cognitive function and mood tests at the end of the experiment, while the secondary outcomes were gut microbial composition and anthropometric assessment measured at each visit and neuronal biochemistry markers from the blood at the end of the experiment.
Hello, I'm Zihui and I'll take you through the results section. The study had 31 subjects in the placebo group and 32 subjects in the probiotic group. It was also ensured that there was no significant difference between the factors such as BMI, age, and gender. Firstly, let's take a look at how probiotic supplementation beneficially influenced intestinal health and gut microbial communities. During the intervention period, no significant changes in the microbial diversity was observed in both groups. However, a deeper analysis at the genus level revealed that in the probiotic group, there was a significant decrease in relative abundance of these microbes as compared to the placebo group. Moving beyond gut health, the impact of probiotic supplementation on cognitive function was also explored. At week 12, the probiotic group demonstrated substantial progress in the mental flexibility test. This finding points to enhanced attention and executive function within this group. Additionally, the study also examined mood and stress levels. Here, we observed that stress scores in the placebo group exhibited an upward trajectory, in stark contrast to the probiotic groups, where stress levels experienced a significant decrease. To better understand the cognitive and mood enhancements, we measured BDNF levels in the participants' blood. BDNF plays a crucial role in learning, memory, and stress regulation. Notably, the probiotic group demonstrated a significant increase in serum BDNF levels at week 12, while the placebo group experienced a decline. Of particular interest is the correlation analysis, which revealed a negative correlation between the relative abundances of specific gut genera and the level of serum BDNF.
I'm Jen Wei, and I'll be talking about the discussion. Firstly, the results show that probiotic supplementation in older adults may reduce inflammation, an age-related increase in inflammatory markers. As mentioned, in the probiotic group, the relative abundance of the following microbes was significantly decreased. These microbes are associated with autoimmune diseases and chronic inflammation in mice. In particular, Alisonella also produces histamine that induces pro-inflammatory responses, and high levels of histamine is often found in patients with Alzheimer's. This suggests that probiotic supplementation may influence inflammation by changing microbial composition. Secondly, the improvement in cognitive function could be due to the interaction between the gut microbiota and the central nervous system. Several studies have shown that gut dysbiosis is correlated with the reduced expression of BDNF, which in turn triggers anxiety-like behavior in animals. In the present study, the probiotic group showed that the change in gut microbes were correlated with the increased level of BDNF. This indicates that probiotics can influence the interaction between the gut microbiome and the host BDNF, hence improving brain functions. But how does a change in microbial composition lead to the improved brain function? Firstly, commensals could produce neurotransmitters and neurochemicals that may directly or indirectly regulate cognition and mood. Moreover, reducing inflammation in older adults due to the change in microbial composition might improve cognitive and mental functions. This is because inflammation might lead to neuroinflammation by modulating GIA cells in the brain, which can cause cognitive impairment. Also, BDNF has a role in neuroimmune responses and regulate neuroplasticity, which is the ability for our brain to learn and adapt. However, at a functional level, the effects of probiotics on inflammation and gut microbiome is still unclear.
I'm Li Hui, and I'll cover what can be further done in the future and summarize the study. Even though some positive results were seen in the probiotics group, there is a lack of direct evidence that shows how probiotics improve cerebral and peripheral inflammation. Moving forward, biomarkers can be identified in further studies. Changes in any biomarkers as a result of probiotic supplementation may give us an insight to the gut-brain axis on the functional level and how it influences inflammation in the brain. Mental flexibility was one of the improved cognitive functions observed in the study. While positive results like these bring us a step closer to reducing neurodegeneration, there were still many other cognitive functions that had no significant changes. Many reasons could account for that, but perhaps time might be partly responsible. As the intervention period was conducted for only 3 months, this short window might have limited its full potential. For further studies, a longer intervention period might yield more benefits. In the experimental design, participants were asked to self-report information on their mood status. As a result, there may be recall bias when details are remembered inaccurately or omitted out whether it was intentional or not. To sum it up, this clinical trial tested the health-promoting effects of probiotics on elders, and it showed that probiotics improved their mental flexibility and stress scores, while decreasing the proportion of disease-causing microbes. Additionally, there's a negative correlation between the reduced gut microbes and serum BDNF level. With a global aging population on the rise, probiotic supplementation can potentially prevent and treat age-related diseases and mood disorders, especially those that can cause cognitive decline. By influencing gut microbiome and making use of the gut-brain axis, this may be a potential pathway to treat age-related diseases to promote healthy aging. Thanks for watching our video. Leave a comment below for any questions.